Ideally, the goal would be to minimize the need for any radical departure from the time-honored systems, while at the same time greatly enhancing the ability to objectively certify the physical acumen of test candidates. Dr. Hyland had heard of the Dynadjust spinal manipulation training systems, and he got a first-hand look at our technology at the recent World Congress in Rio de Janeiro this year. Shortly after the convention, I had the pleasure of opening the dialogue between Ortho Neurotechnologies and NBCE to begin working on the logistics of taking on the challenge of addressing these issues and bringing them to you. On behalf of the entire Ortho Neuro team, I would like to express our great appreciation of this opportunity to present what I hope you will find to be an exceptionally well thought out and beneficial strategy for implementation of the Dynadjust systems into your testing venues. Next is a short clip recorded at a very special meeting which was arranged for us by David O'Brien of ACC-RAC, specifically for the Chiropractic College presidents, where Dr. Triano passionately expressed his opinions of the powerful potential of the Dynadjust spinal manipulation training systems and the technological marvel of his own custom testing tables designed to verify the skill levels of our practitioners. This was one of the most powerful and exciting presentations that I've ever seen, and the entire video recording can be found on the thumb drives that we have provided for you here today, along with all of the other OrthoNeuro videos that you've seen today, and also a very inspiring video of Dr. Triano presenting his original Dynadjust research at Texas Chiropractic College. We now, I submit, based on the data I'm about to show you, can quantify and validate individual skill performance so that you can say that this student is high quality. And we can represent where no other profession is capable of doing it, that this student qualifies, he should be licensed. Dave and I were especially pleased that Dr. Scott Haldeman recently agreed to take a meeting with us at his offices in Santa Ana, California to discuss the future of the Dynadjust project shortly after our meeting in Rio de Janeiro. Dr. Haldeman graciously spoke with us for nearly 2 hours, discussing nearly every aspect of our technology and its application in modern chiropractic education and testing. We were appreciative of his sage advice and insight. It was during this meeting that the idea emerged that in order to minimize and even eliminate the time lag between implementation of the Dynadjust systems into the standard curricula of our institutions and the ability of NBCE officials to utilize our systems in Part 4 testing, that Ortho Neurotechnologies should offer comprehensive courses to the upperclassmen at the colleges, thus facilitating the process. This was a timely idea, as it was only a few weeks later that we engaged with Dr. Hyland to coordinate the logistics of discussing these ideas at length here in Greeley. Having developed our Dynadjust continuing education programs, our certified practitioner and certified administrator programs, and having engaged with Dr. Brian Gleberzon and Dr. Kim Ross to develop a Dynadjust scholastic program for use by any chiropractic college as a turnkey curriculum or as a foundation for creating their own new Dynadjust training regimens for the first and second year students, we have turned our attention to addressing the logistics of implementing the Dynadjust into the NBCE Part 4 testing venues. Thanks to the elaborate NBCE website, where we were able to garner some insight into the present psychomotor skills testing methodologies, we believe that we have a solid understanding of how the Dynadjust technology will enhance the NBCE testing procedures and provide even more useful and objective evaluation of the student's abilities, and to do so conveniently and without undue disruption or complication of the present time-honored systems, with the ultimate goal of even further enhancement of the usefulness and relevance of the Part 4 psychomotor skills evaluation tests in a way that no other discipline could possibly approach or replicate. The fact of the matter is that the simple act of handing a pre-programmed Dynadjust unit to a student candidate, having them assume an approximation of the appropriate doctor-patient positioning postures, and then using the objective feedback provided by the instrument to modulate their force, depth of thrust, and accuracy of their line of drive provides tremendous objective insight into the ability of the student to control and modulate their techniques. And for these particular testing goals, there is no need to engage our online OrthoNeuro Service Center. Here are some examples of our vision of how the Dynadjust technology could be most easily and effectively implemented into the existing structure of NBCE Part 4 testing procedures. Here the candidate has been advised that the patient has a fixation lesion at T7, T8 and is asked to adjust the T7 segment into flexion in the patient prone position. The candidate palpates for the C7 prominence, then he carefully palpates the SPs to locate the T7 SP. He uses his anatomical knowledge to correct his contact for the length of the T7 SP and positions himself with a bilateral thenar contact. He describes his adjustment vector as P to A and inferior to superior. Satisfied with the candidate's approach so far, the proctor hands the candidate a Dynadjust instrument which has been pre-programmed with the parameter setting and resistance level appropriate for this procedure. The candidate is instructed to approximate the appropriate doctor-patient positioning with the instrument and then to produce thrusts concentrating on the feedback from the instrument to modulate his thrust to accommodate the pre-programmed parameter setting and to perform the thrust with as much speed and accuracy as possible. A green light on the instrument indicates that the candidate has modulated his thrust to accommodate the parameter setting. Each time the candidate produces a thrust that falls within the correct parameters, he calls out the force generated and the percentage of deviation from a straight line of drive in the X and Y axes. These values can be either recorded or it can be up to the proctor to judge the quality of the thrusts on a pass-fail basis. Following the flexion adjustment evaluation, the candidate is asked to perform another adjustment. This time the lesion is at T12 L1, and the listing requires an adjustment of the L1 vertebral body into left rotation. The proctor asks for a single pisiform contact. The candidate again palpates for the appropriate vertebral level, taking his pisiform contact on the mammillary process of L1 and describes his thrusts as pure P to A. The proctor hands over a second Dynadjust instrument, which is programmed with a completely different parameter setting and resistance level, and asks the candidate to perform his thrust and call out the force and deviation values as before with each green-lighted thrust. These procedures can be easily reproduced in any combination of patient positioning and thrusting techniques as the NBCE officials deem appropriate. And of course it will be the informed decisions of the NBCE officials that will determine the actual adjustments to be performed, the Dynadjust settings utilized, and how the candidate is instructed to perform the adjustments, and what values will be considered adequate and appropriate for each testing procedure. Our proposal includes an online orthoneurotechnologies course of study which each candidate will complete within 30 to 60 days prior to the Part 4 exams. This course will be a comparatively rigorous home study regimen designed in cooperation with NBCE officials, during which the candidate will have unlimited access to the Dynadjust instrument and OrthoNeuro Service Center, and will have up to 30 days to refine their techniques for the types of adjustment simulations that they will be asked to perform in their Part 4 testing. We welcome the opportunity to work with the NBCE officials to complete this task, and we welcome the challenge. In conclusion, the essence of our message today is that the new Dynadjust spinal manipulation training system is the first and only system which is capable of safely and efficiently facilitating the development, refinement, and maintenance of HVLA thrusting acumen, allowing for careful monitoring of the student's progress and fitness for advancement, and incorporating scientifically proven training techniques to produce lasting beneficial changes in the actual skeletal muscle physiology of our practitioners, and to allow comprehensive and objective verification of HVLA skills development with convenient, easily integrated, and essentially turnkey programs from OrthoNeurotechnologies Incorporated.